being said, I would like to welcome all of you to our roundtable titled Navigating Compliance, ensuring Healthcare Language Services Meet Industry Standards. In today's diverse healthcare landscape, effective communication for LEPs or limited English proficient patients is just the best of practices and is also regulatory necessary. We'll cover some questions that I know you guys would love to hear from this panel. And I will go ahead and first introduce myself. My name is Katherine Adames, and I will be leading this discussion. And also with us today, Liz, I'll go ahead and allow her to say hello to everyone.
Hi, everyone. My name is Liz. I am the language access expert with Effectiff. I've been in the language industry for about 15 years, and I've been with Effectiff for almost one. It's great to meet everyone.
Thank you so much, Liz. Jorge?
Hi, good morning, everybody. Thanks for joining. Thank you. Special thanks to Effectiff as well for putting this on, and for the rest of the panelists who are going to be sharing valuable information. My name is George Mejia. I work as a Director of Language and Inclusive Services here in Ventura County. It's a new position with the goal of establishing exactly what this conversation is about, establishing language access in a compliant way, but also in a meaningful way. So coming from Monterey County, doing the same with my mentor, Victor Sosa over there, and now trying to replicate it here in Ventura County.
Thank you so much, Jorge. Chris?
Hi, I've been in language access for about 25 years, really. I love this work. I chose it as my area of practice and academic research. And so I've been happy to serve and very satisfied to serve as both an interpreter in the earlier days of my career, and then language services subject matter expert and language access subject matter expert, working with nonprofits and public companies and for-profit companies.
Thank you so much to all of you. To those that are joining us via LinkedIn, please feel free to drop your questions in the chat. We will address those as we conclude this roundtable, if we have the time for a Q&A session. So let's go right into subject and our first question, and I know we will have more from all of you listening in. How can healthcare organizations turn compliance from a checkbox exercise into an opportunity to innovate and enhance patient experiences? Who wants to take on this first question?
I would love to start, if you guys don't mind, gentlemen.
Wonderful.
Awesome. So one thing that I find really helpful when we're working to create more of an intuitive language service, more of an interaction with our patients and our communities. I think that it's really important to ensure that we're connecting with those individuals, with those end users. A lot of times that's the piece that we're missing. We don't know that this person didn't have access until it's in a news article. We don't know that, someone had an experience and they needed to share it and they didn't know where to go. They didn't know who to talk to. So having real and open conversations with patients, with their families, with the communities that are supported by these healthcare systems is a really great place to start. Even just asking them, hey, what do you guys think? What can we do? Is an amazing way to start the conversation.
Thank you so much, Liz. Jorge or Chris?
Chris, go ahead. You can start if you like.
Sure, gladly. Yeah, I think in general, universally, people are good, and we can foster empathy through education. When people understand the services of language services, language access work does save lives. It improves healthcare outcomes. When we understand that we are doing good, people are moved toward that mission. And so how do we turn it from just a checkbox of compliance to a passion, to a mission that everyone is on the same page for? I think it's by fostering empathy through education.
Wonderful.
I believe just how Elizabeth and Chris mentioned, it's a mind shift, right? It's a shift of attitude, a shift of perception and perspective. Really, one of the biggest ways, in my opinion, and from what I've learned, to be able to shift that is to look at compliance as a starting point. The very fact that it's kind of looked as a checkbox makes the idea that it's the end point, is the end result, is making things in compliance, but really it's a starting point. Compliance is how we start making language access, patient experience, become embedded into the overall culture of any organization that we're functioning in. And with that, we also now start offering proactive language assessments during patient intake. We elevate the patient's experience. We start building a more inclusive, more responsive system. So a lot of the times we focus on being inclusive, but we also want to have it responsive, make an actual forward motion in regards to making that experience better. Ultimately, it's about seeing language access as a more core component of patient-centered care, and using compliance as the fuel for improvements.
Wonderful. So you guys mentioned, and in my words will be something like making compliance an advantage instead of a disadvantage. And I think that sometimes when we look about the service that we provide, some of our clients turn to compliance as something to be scared of. But in reality, we're offering a big help. And there's a lot of services out there and a lot of companies that do a great job to provide these services. And talk about passion, the great interpreters, like you said, Chris, the great interpreters that we have trained, the great interpreters that we have built and that continue to provide these services, not only as a career, but understanding that it comes from the heart and that what we're doing matters. You also mentioned, sorry, Liz, go ahead.
No, go ahead. Go ahead.
I think something very important, and that we also see it in when we're putting together a language access plan, is utilizing all the data that we have. So also including technology, instead of freaking out because technology is involved, let's also use it as part of keeping our organizations compliant. Liz, please go ahead.
Yeah, I was just going to say, I worked with the deaf community for a really long time, and within the interpretation community and the deaf community, they have something that's called Deaf Heart. And it's just having a heart for the community that you're serving, the community that you're working with. And I think that's exactly, what you guys are talking about, Chris, where the heart is there. We need to just make sure that they have the access to information, the teams specifically that are working with those patients, because they've got the heart too. We all do. That's why we do what we do, So I think what Chris said about education and training and making sure that, we all understand how those resources are available can open up and can prove that there is empathy and that everyone is good.
Yes.
It's not intentional.
Yes.
And one thing that I could add as well is that, and to kind of echo Liz's expressions there, is that on the opposite end of, making this regulatory and really giving the highest quality, is the real world pushback of expense. And, I see in the comments where it says that it's looked as an expense, and that's true. I mean, when it comes to any sort of support services, it's always an expense.
Mm-hmm.
One way that I like to phrase it, and one way that I've heard it as well, and I think it's a better perhaps outlook. It's the cost of doing business. That's probably a better way of looking at it. And there are many things that go into any organization where, if you look at it from the standpoint of a cost of doing business, it becomes a necessity that you or the organization wants to fill, as opposed to that they have to fill it, because the end result is much better than just the mere expense.
The goal is to make sure that everyone has a good experience, and that the people that we service, especially on the healthcare industry, understand everything that's going on around them. And there's no other way. If I don't speak English, or if I cannot talk, I would like to get all the information in my language. Thank you so much for your answers, and we will go ahead and move to our second question here. And I find it so interesting, and I want to hear from all of you. So what unexpected lessons have you learned while implementing language services that meet regulatory requirements? Were there any surprises along the way?
I might not be able to identify specific surprises, or at least can't remember them because it's been a while. But I will say that there have been, and there will always be, discouraging, disappointing, resistance to our work. And I think
Yes.
that, again, not to harp on the same idea, but once people understand that the work we're doing is more than just cost benefit analysis, but we're talking about people's health care, we're talking about people's well-being, and also we're talking about a society that in our people's most vulnerable moments, we want there to be an overt expression of equitable care. And when people understand that this is a necessary ingredient, language services is a necessary ingredient to that, they move away from the resistance. But I think the roadblocks, the surprises, the disappointments, the discouragements are usually, at least in my experience, as a result of the culture resistance. I don't want to have to push a button to talk
Yes.
to an interpreter
Mm-hmm.
so that I can communicate with this patient. It's just a pain in my butt. And
Mm-hmm.
so let me just my Spanish is good enough, or some other expression of that. I think the disappointments, surprises are usually centered around hoping, wanting, expecting that everyone is looking at the world through the same lens that we are, but everyone isn't, and so we have to avoid the condescending, oppressive, authoritarian expression and enforcement of regulation, and move toward a let me help you understand why this is good for our
Yes.
community, why it's good for our hospital system, why it's even good for our bottom line. And
Yes.
so I think the surprises are usually centered around the disappointments and discouragements of resistance. In my opinion.
Chris, I hear the interpreter in you, and I understand it completely. Jorge or Liz?
Yeah, I mean, I think Chris hit it right on the head. I don't think he's been far away from it for too long because you have it fresh there in mind. But I think realizing how much of a gap still exists in the knowledge and training of frontline staff. You know, whatever organization you work in. Myself, I've been working in healthcare for a long time, so it's this concept, this idea that it means something different to them than it might mean to us as experts.
Yes.
And it's not too unlike, physicians and healthcare providers, right? When they speak to their patients, they'll speak the language that they're speaking to give healthcare, and they assume in their mind that they're getting it. But healthcare literacy is the big gap that still exists. There's so many patients that don't understand why an MRI is needed, why an operation is needed, why. So physicians struggle with this concept as well, but I find that I struggle with the same thing, is that they don't understand when I say interpreting what I actually mean, or
Mm-hmm.
translation what they actually mean. Like Chris said, sometimes it's a good enough Spanish. Well, we're just speaking Spanish, and so it has to be a part of the ongoing education, a more comprehensive approach, so that we can integrate it into the actual healthcare culture.
Yes. I want to read a comment that Jody posted on LinkedIn. She says, interpreters are not there only for the patients and family, but for the providers who cannot effectively and appropriately direct or prescribe patients if they do not understand what they're going through. We focus a lot, and as interpreters, I know we do this, as an interpreter myself, I should say, but the whole goal is to make sure everyone communicates appropriately, and that the patient and also the providers are able to understand each other. So you guys touched on a very human part of this, and I love to hear that. Liz, I can't wait to hear from you now.
One thing that I really, I have a different perspective, right? I worked as an interpreter. I was actually a teacher as well. So I was occasionally an advocate for students trying to enter the healthcare system for one reason or another. But I've also, from the outside looking in now as a member of a vendor service, I a language partner. I see that the struggle that these health systems have with getting those in-person interpreting services.
Mm-hmm.
It is so hard, guys. We see it. I mean, we're part of providing those interpreters, and Katherine, I know you and your team know the struggle. It is hard, especially in those rural areas. And not all interpreters and patients are going to mesh. It's
Mm-hmm.
not always going to be a good fit, and
It's
that's
not
okay.
a one size fits all.
Yeah, that is okay. It doesn't mean that your interpreter is not a good interpreter
Mm-hmm.
because they had to say, hold on, let's get some clarification first. That means they're a good interpreter because they're saying we need to stop, clarify, make sure everybody is good to go and understands and move forward. that is a good interpreter. But again, it's not always going to be a perfect fit every single time. There are so many dialects out there. I mean, Arabic is one of those languages that is so rich. There are so many different dialects, and they do not play nice sometimes. So when you send an Arabic interpreter, they might not have any idea what your patient is saying because of those very specific regional differences. So that's something that has been interesting from this perspective, of seeing what goes into finding the correct interpreter for the job, making sure that you're meeting those requirements that the patient has, whether that is in person, maybe they have issues, they're maybe an elderly person and they have issues with virtual, they can't use over the phone, or it's a serious situation and in person is the best option, like labor and delivery. There's so many things out there, guys. It's never going to be a one size fits all perfect scenario.
And I think ASL is the perfect example.
Oh, yeah.
Not everyone speaks the same language, if I may say it this way. So one size does not fit all. In my experience, just to add a little bit to what you guys are saying, we've had pushback from clients because of lack of training. And as language service providers, I think that we've done a great job at trying to help these organizations train their staff. For the success of the communication, people need to be trained. People need to be taught how to work with interpreters. And I remember back in the days when I started doing this 20 years ago, part of our introduction was explaining, like a briefing of, okay, well, you're going to say this, and then you need to pause, and then I am going to interpret, and then that's how the communication goes. I think that a lot of this has been lost, but if organizations understand that for the success of our services, they need to train their staff is a wonderful thing. And then interpreters are culture brokers. We're not just there to, yes, we're there just to interpret because, of course, if I say something different, CCHI may ban me or I will get in trouble as a certified medical interpreter. But we're also culture brokers. There may be situations in the communication that we understand are not clear because of a cultural situation, and we're okay as part of our protocol to intervene adequately and say, hey, there is a cultural situation going on here, and I would like to bring it up to you guys. So thank you so much for answering that question. And we're moving on to our third question. If you could redesign the compliance process for language services, what would you prioritize to make it effective and user-friendly? And guys, we are struggling with this one because of all the languages that we have seen in our nation this last 2 years and the lack of training for these languages. Who wants to go first?
I do, if you guys don't mind. Sorry. This is something we've already touched on that I was very excited when I saw this and really inspired by the question, to be honest. I feel like, as we've already said, training is a huge component for healthcare systems. I've gone through the trainings as an interpreter working with healthcare system. We had to go through various trainings as well. And, it's click, 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 quiz, done. And that's it. And it happens once a year, but maybe it's just the first orientation when you're hired and that's it. And I think that it would be monumental to have a different kind of training that talks about language services, that talks about patient access specifically, that involves conversation. Because how better to learn and understand than to have a conversation? Have a conversation about what you're doing with those patients that come in that speak another language that you don't know what they're saying. How do you make connections with them? How do you get that ball rolling for language access? And then include a team discussion on that. How can we make our department, our services better? What can we do to help our patients feel welcome? Because without language services, they don't feel welcome. They don't feel cared for. They don't feel safe. They don't want to be there. They are terrified of every next step. And that is not what healthcare should be.
That is very true.
Training.
Yes, that is true, Liz. Chris?
I think some of the things that should be reprioritized or newly prioritized as the shape and face of healthcare changes is that leadership, both healthcare system leadership, supply chain leadership as well, maybe especially, should also be required to understand, and LSP leadership, by the way, as the industry changes and organizations are being merged and changed, and the leadership is no longer conversant even in the industry. I think education that permeates all the way to the top is important. That supply chain would understand the impacts of the changes and policies that they're making and forcing on LSPs. So supply chain areas of the hospital are saying, I don't care what kind of service you provide me, the only thing I care about is that you reduce my cost by 20%.
Yeah.
Without understanding the impact, the healthcare impact and the healthcare outcomes to the populations that are being served in the communities where they are dedicated and committed to serving. And I think some of those problems, some of those disconnects will be mitigated with some of the training and education, some of the understanding that was necessarily permeated, was necessarily delivered to the very top levels of both LSPs and healthcare systems.
Yep.
Teach the supply chain agents. Teach the supply chain agents, please.
Yes, please do that. We will all appreciate it. The more information, and I think understanding the whole process from when it has to start until it's, delivered, that is key to success as well. Jorge?
Yeah, I mean, I think that again, it's hard to kind of say anything that's different. Training definitely is a big component, in education, not just training of interpreters and giving them the tools that they need and refining the tools that they have and whatnot. But oftentimes we find ourselves as leaders ourselves, or if we find ourselves in the privileged position of being a director or a manager of language access, it's sort of like mom trying to spoon feed us vegetables, right? When we were kids, it's like there they are trying to give us something good, and we're kind of pulling away. We don't want it. We don't want the taste of it. And often we do feel that way. So I appreciate what Chris was saying, where leaderships and these champions within organizations that understand and can value it, and then can also lend a hand in persuading others. It's not an easy fix. So, maybe something that helps us empathize is, when was the last time that we accepted a new belief system or structure that we didn't have before? And how long did it take us to accept it? That's what we're dealing with. So it's just an ongoing effort. One way that I have been pondering over this, because of where I find myself, though, right now, starting a new department, is that I would probably say that when you're starting from scratch, you definitely have to prioritize data collection and identification. Data is the one language that everybody speaks at some capacity. Whether we understand it, whether we like it, whatever the case is, data is data. And so if you don't have good data, your argument for establishing language access is somewhat weaker, because the problem is not religious. The problem is in the execution of it. It's the day-to-day. So real-time language assessments and tracking of language needs, that's probably where I would redesign a system where it's more real-time, where it's easy. Oftentimes I find myself people asking multiple questions like, what's your primary language? What's your preferred language? And so now it becomes very muddled. It's like, let's try to find an easier, more streamlined way of accessing the information we need, so that we can identify it down the line, right, when they come back, and then create a feedback loop to continuously improve that service based on patient needs and satisfaction.
Yeah. For us as language service providers, we've had a big hit on lack of resources lately. And one of the reasons for this is because our government and has become more strict when it comes to compliance. Therefore, the training for interpreters are a must, yet they're making our training sometimes a little bit even harder and not accessible for rare languages, for example. And I think that is also something that we need to look at within the language access. I also saw a comment from Dr. Testai, and I'm sorry if I'm reading your name wrong. So she's asked, I can't see your picture, I'm a little blind, but you're saying, so how do we make organizations understand and teach human resources to understand who to hire, especially leadership? I think the language industry needs more advocates, more people like us to hear us out, understand the struggle, and also the patience. The fact that some organizations do want to ask their patient how the outcome of their visit was. I think that's, and having people listen, because one thing is you asking and forgetting about it, and another thing is evaluating the answers of these people. Is our goal really to make sure that the outcome of the communication is positive, or we just want to provide interpreting services because? So more advocacy from all points, from the language service administrators as you guys, from people in the business development world like Liz, and then also from the LSP's operations like myself. We see the real struggle, and also allowing us to use resources that we have in various places, especially now. We've had to go to Guatemala, to very distant countries in Africa, to make sure that the people in this country, legally in this country, are able to communicate and understand their health information. So I think everyone has a bit of responsibility so that we're all are successful. Okay, so moving on to our next question. What do you think patients notice most when language services fail to meet compliance? How can providers, I don't know how to read this word, preemptively address these gaps? I did great. Okay, I want to start with Jorge, if you don't mind this time.
Sure,
Did I
sure,
put you on the
absolutely.
spot? That was a good
Yeah,
one.
this
That was a
this this, this is a good one actually because of the location and this kind of mimics where I came from. We have an indigenous population that comes in that speaks indigenous languages from Mexico, Central America, that are very hard to find, very difficult to pinpoint, very reminiscent of what Liz was talking about in regards to Arabic. There's a lot of different variances that change. So this one's actually kind of interesting to me because when a patient walks into an organization and that language services fails or it's not around, it's very akin to us showing up to a dinner because someone let us through the door, but we know that we weren't being expected. And maybe they'll give us some food out of obligation because they have to, because we're there now. And we've felt that. And so this is kind of, in a big way, really, the patients immediately notice that this organization wasn't for them. It's, even though they might say, hey, we're here for you, they can feel that that's not the case because their language is missing. And
Yes.
although it may be unrealistic to have all the languages available to some extent, that's the goal, right? The goal is to close that gap. So I think that one of the ways that we are able to do that, we preemptively address this gap, is with communication being taken into account preemptively or before the actual communication is created, and not as an afterthought. And so one way that I see this is when we create signs or communications in writing that are written with a certain audience in mind.
Yes.
But if you go back to the inception of it, to the actual creation, you can tailor it to fit the needs of different demographics, and you have to change it. You have to tweak it because what speaks to one demographic doesn't speak to another. And
Right.
something as simple as that person doesn't look like me. I don't identify with
Yes.
them, right?
Yes.
And so if we take it back to the inception, to the creation of it, that's how we can preemptively address the gaps and make language experts a part of the creation of those communications.
Yeah.
You're talking about belonging, and I think everyone needs to feel as they belong. Love it. Love it. And these comments are so wonderful on LinkedIn. If we don't get to comment or answer any of your questions, please know that our team will get back to you. But it is just delicious what I'm reading here. Thank you so much for also giving us your opinions and your thoughts. I just wanted to recognize the comments on LinkedIn before I moved on to Liz.
Yeah. So, in this kind of a situation, my experience is with the deaf community, as I mentioned. So I always think back to those students I've worked with, those patients I've interpreted for, and I think about their experiences. When I show up and I walk in the room and they're just like, oh, thank God, they heard me. They know I need something. I can now express what I'm feeling, what I need, because writing back and forth wasn't working. I didn't understand. The doctor couldn't tell me, I couldn't tell them. We didn't understand each other. And there is a sense of, as soon as you walk in the door as a deaf person, if they're going to help you or not. And it gets around. It's a small community. They're not going to show. They're going to I'm not going to go there anymore. I'm not going to try town halls because there's not going to be an interpreter. Why would I even? They don't care about what I have to say. The election, they don't want to know what my voice is. There's never any access for them. And they are almost often so used to it that they just don't have fight in them anymore. It's just too much. Frustrating. And that broken feeling of it's just not possible. It's not going to happen for me. I know I'm not going to have access. I'm not going to know what's happening to my parent who is hospitalized and going through some procedure because I'm deaf and it's too hard for people. They just don't want to put in the effort. And that's what it ends up being. That failure is because I don't matter enough. They didn't want to put in the effort. It's too much. Is really sad.
I think we need to recognize the deaf and hard of hearing people because they have really made us aware of language rights. They have brought this out there, and they have also helped us, the speakers of different languages, and our families to understand that there is a law and we have to be compliant because of that law that comes from 1964 and maybe way before those times. And they are in their way so loud about, I have rights, I need to understand, I need communication. And all of us in the language access industry need to recognize that. Chris?
Yeah, I've liked all those comments, and I liked Jorge's long game approach there. So I'll mention something shorter term. I think one of the ways we can preemptively address the gaps that happen, and those gaps cause confusion on a patient's part, cause uncertainty on a patient's part, and a patient's family's part, sometimes even more importantly.
Yes.
And we can preemptively address those gaps in some way by better data collection, by better data housing, by making sure REH, the electronic health record for each patient, does accurately reflect the language that person speaks.
Yes. I want to read this from Jody again. The fight should not have to come from the patient. We have to advocate on their behalf. That is a big one. Advocates. And we try all the time to let our families know, at least those of us who speak another language, that you have a right to this, and you shouldn't feel, like you said, Chris, they shouldn't feel confused or disrespected in some way, or they shouldn't feel anxious, because if you go here, you should have access to language.
Yep.
And we should avoid, as people in the healthcare industry, also delaying some folks' care. Some people who are giving birth, women giving birth. I read in the comments also people with infectious diseases. And it's true, doctor, we don't want them to go out and spread these things. We want to make sure that they're getting care as they should. And these are very important topics that we have mentioned here.
Can I just pop in one more thing?
Yes, of course.
Okay, I meant to mention this in the very beginning, and I totally forgot about it. But one of the things I think that we could do to address the language gaps and bring in those services is to educate the community through social media posts in their languages. So you're posting about the access available at this hospital system in the top 5 languages, for example. just pop one out there every once in a while. Your community is going to start seeing it, and they're going to know, okay, I have access here. I'm going to go there. And they're going to tell the other people in their community. And before you know it, you're going to have an increase in, patient access, patients coming to you, which is good, but you're going to be able to help them a lot quicker because they're going to be able to say, like, hey, I need help. And I know you guys have services, so let's go.
Yes. I want to address a concern that I see on the chat about advocacy, and I want to speak on behalf of the interpreters. We know very well that we need to be very careful when we advocate because we know what rules we have to comply with these situations, under which regulations. But for example, speakers of other languages can also advocate with their families if they know the law, if they understand why these services are important. And also the organizations or the hospitals can advocate for patients if we see, any negative situation happening. And I think we are kind of pushing towards a positive way to look at advocacy instead of, looking at it on the negatives of it. Okay.
And
Yes, it definitely requires finesse, Jody. Absolutely right.
I want to just kind of just pinpoint on that point right there that advocacy is a word that sometimes has had a bad rap.
Yes.
And part of it is because I think that the judicial system tends to be very adversarial. So when we think advocate, we think about lawyers, we think about a fight, we think about, someone winning and someone losing. But the concept of advocating is that it's not always a shouting match. The truth is that if you're advocating correctly, you're not really raising your voice, so to speak, right? Sometimes advocacy is very subtle because I think Chris was the one that said this earlier, and I believe it to be true, is that generally speaking, people are good. They want to help. And so sometimes they just lack the vision, they lack the know-how. And particularly in healthcare, but in other organizations, the majority of people that are in healthcare is because they care. Otherwise, they wouldn't be in healthcare. So I think like Jody was saying, yeah, definitely finesse, but that comes now to the responsibility of those who are in a privileged position to advocate. We also have the responsibility to advocate the correct way.
Absolutely. Absolutely. These comments are wonderful. I can't like all of your comments right away, but we are reading you. We agree with many of the things that you guys are saying. We hear you as well. We understand what you're trying to communicate, and we are very thankful for you guys being here with us and being part of the information that we want to share. Okay, so our last question, and I don't even know if this one is possible, but if there was one golden rule for aligning language services with compliance standards while enhancing equity and care, what do you guys think it would be and why? It's a tough one. I know.
I feel like I've been addressing that. Oh, I'm sorry. Go ahead.
No, sorry, Chris. You want to start, or I just felt like I think you're right. The reason why it's so intimidating is because there's this big gap between the world that we live in, the realism of the reality that we live in, and the utopia that we would love to live in for everybody. But so the golden rule, the way that I kind of see it, is more of it begins with me, and the way that I phrased it is ensure that language access is not an afterthought, but a core part of every patient's care plan from the moment they enter the healthcare system, in my case, but in any case, any other system. When you ensure that it's not an afterthought, then you really kind of have the opportunity to give the best, quality and results of equity and care and access to these services. So it has to be embedded in the workforce. It has to be embedded in the essential parts of the areas or the organization, not supplementary, which is, again, you have to shift that mentality. And that's difficult to do, but it's a necessary one to do as well. And we've already done it in a lot of other areas, even like healthcare, doctors now are an essential part of society. They used to be supplementary if we go back, enough in time. So we're moving in the right direction, but it's a tough one, and we still have a long ways to go.
Yes. Jorge? I'm sorry, Chris?
I mean, I think that the golden rule, the kind of the ubiquitously understood golden rule to treat others as you would have them treat you, I
Yes.
think is still the right rule here. The golden rule for aligning language services with compliance standards is to foster empathy. The golden rule really is about empathy in action. Not only do I feel a thing, but I make sure that I treat others in that same way. And that, I think, is the golden rule that is ubiquitous, is the golden rule that should be applied here. We can align language access compliance by helping to create and foster a culture of empathy. And generally that comes with more knowledge. When providers understand that when I do this, when I engage a professional interpreter in this engagement, in this interaction, this patient's healthcare outcome is statistically understood to be better because I engage professional interpretation services. Understanding that people's lives are better, fewer people
Yes.
die, fewer
Yes.
adverse events happen, fewer people are readmitted into hospitals, which is very expensive.
Yes.
When I engage empathy, I make sure to engage interpreter services or language services.
Absolutely.
Yes.
How would you feel if you went to, I don't know, China? I mean, everyone speaks English, so we have an advantage. But if there is a country in the world where maybe France, how would you feel if you were under a situation, as we see many patients in our country? How would you feel? And you said it. Let's do to others as we would want to be done to us. Love that. I would love to also read from an interpreter. What do you guys think would be the golden rule for language services with compliance standards while enhancing equity and care? I want to read from the interpreters also that are listening in. Liz?
Yeah, I love what Chris said. I love, empathy should be the cornerstone of what we're doing, of what everyone is doing, being able to understand, or at least try to understand, where another person is coming from. And I think a lot of the lack of access that we see is from a lack of experience on the other side. If you've never been in a place where you can't talk to anyone, no one understands what you're saying, then you don't know how scary that can be.
Yes.
And, as someone who, if you've never, that's it right there. If you can't imagine what it would be like, that's where those conversations come in with our teams and the trainings, and, just keeping those conversations going.
Absolutely. It is such an important job what each of you do, what each of us do. From wherever we participate within the language access industry, the interpreters, I can never say enough that, your work is very valued. I understand, I've struggled, but we do so much for the people. And what we do and one service that we provide goes a long way. It could be just resolving, outside of healthcare, just resolving a traffic ticket that a person got. They got that thanks to you helping them communicate. Maybe they just got that ticket off their record. Thanks to you, a mom was able to hear the teacher talking about their child with special needs and understanding how they can better help them in school. And we do a lot, and we are so thankful for the work that each of you do. And I'd love to recognize that. And I also feel that the job that we do is a job of love. And when I had to be involved in quality, that I would hear an interpreter just lacking empathy, careful there, because we also have to mimic the way that a person speaks. But you can also hear an interpreter when they don't care because they're not communicating adequately and the communication breaks. I would tell the interpreters, I think your time is up and you need to reconsider if this is the work that you want to do. And it is of humble people to recognize when their job is done somewhere, just leave it or maybe take a break and go. And for those of us who are part of the organization of providing services, be a spoken, signing, or writing, when it comes to translation, your work is also very important, making sure that the patients in the hospital are able to see their records. Maybe they came to the US and they want to take their medical record to their country. What you translated in that document and what you guys, Jorge and Chris, helped coordinate is very important. So I want to recognize the work that each of you do. And I also want to thank you all for participating in this roundtable. I would have to say, and I don't know if I'm going to get in trouble, definitely one of my favorites, talking about healthcare as a healthcare interpreter and touching on these sensitive subjects that sometimes are only looked at from the point of money and expenses. Just hearing you guys who are leaders talk about compassion and the love that we have for what we do is just music to my ears. So thank you, and thank you to all of you that have commented anything and everything on LinkedIn. And I don't think we have any questions to touch on, but just very nice comments that you guys have left for us there. I want to thank all of you for your time. And Chris, Jorge, and Liz, I hope to see you again soon. Thank you so
Thank you
much.
very much.
Thanks for the
I
great
enjoyed it very
conversation,
much.
everyone.
Thank you. Yes.
All right, everyone. Take care.
Thanks.